We're going to go through an exercise to engage some lateral hip stability, specifically gluteus medius. It's a hard area to engage without compensating with the muscles in the front of your hip. So a lot of the little specifics to the way your body's positioned are very important. So I'll show you facing you and facing away. It's nice if you have an area to drop off the edge of, whether that's the edge of your bed, the side of your couch, so you can get your leg into this negative position. So I'm going to go to the back edge of this table. I'm going to lay down on my side, and my bottom knee is going to be bent up towards me to help my lower back stay flexed so it's not arching. And then my top leg will straighten out, and I'll take my leg back so it's just off the edge. Now, another piece that I like to have people do is take their chest and turn it downward so there's not that tendency to rock your whole pelvis backwards, which will make you use more of the front of your hip. So you're going to rock a little bit forward. My foot, I'm going to try and keep my leg straight and my toe slightly in without it going outward at all, because outward will once again make me use more of the muscles in the front of my hip. So as I start off in this position, right against this area where I can drop my foot off the edge, I'm going to extend my hip back, foot is turned in a little bit, and my chest is slightly towards the surface I'm laying on. I'm going to drop my leg down slow. And this is going to start to put tension on a few structures, my IT band, gluteus medius, and I want to try from this stretched position to engage these areas. So I'm slowly going to raise up, leading a little bit more so with my heel. And I'm not going to come up very high. I'm going to go to just about this normal, neutral, lengthened position, not really going beyond neutral, maybe just a hair beyond, but most people you'll see they really kick their leg up in the air. I'm not worried so much about that. And then I'll slowly lower back down into that stretch. And then once again, leading with my heel, with my toe slightly in, I'll come up. With the goal of feeling this in this back corner of my hip. Many people will compensate and they feel it up here in their back, and that'll happen if I go higher up into the range. But if I stay in that lower range, it's really going to isolate this aspect of my glute, working it more into a stretch. Slow and controlled going through this motion. Somewhere in the 10 to 20 reps is desirable. So just so you can see me from the other side, I can give my other hip a break. So I lay down, bring my bottom knee up towards my chest, top leg is straight, I angle my chest towards the surface I'm laying on, and I extend my hip. And you see I extend my hip without rotating my pelvis. And then once I get there, I slowly drop down into this lengthened position where I feel some tension on the outside of my hip, and I lead with my heel as I come up just beyond that neutral. And then I go back down slowly. If you experience any pain at all with this, I encourage you, one, to find a range where it's not painful. And some people, they're not even able to go through this range yet. They may have to prop their leg up on something to make this an easier movement. So the regression from something like this, if this is too hard, would be to take some type of bolster or even the armrest of your couch. And rather than go into that negative to start, first you see if you can just, in this position, de-weight your foot a little bit. So this would be a regression from what I just showed you. And then obviously I would take the thing under my foot and make it smaller so that I can start working a little bit lower, even if it's in a small range, gradually going deeper and deeper towards that lengthened position.